Joining us right now is South Dakota Senator, member of the Armed Services and Banking, Housing and Urban Affairs Committee, Mike Round. Senator, it's good to see you this morning. Thanks so much for being here.
Good morning.
Before I get to your bill, Senator, do you have any reaction to what took place in Tokyo with Carlos Ghosn?
Now, we haven't really been following that as an immediate story right now. We've been working on the issues surrounding North Korea and also with regard to what's going on right now with the emergency powers and so forth that the president has exercised.
Yeah, fair enough.
Those have been the items that have been keeping us busy.
And I want to ask you about that because I know that the president said that he's going to veto that in terms of the national emergency outrage. But let's talk about your health care bill and the Cadillac tax. Tell us the impact of that Cadillac tax and why you want to repeal it.
Yeah, if we don't repeal it, it actually goes into effect in 2022. And right now we have a president that I think would work with us on it. We're not sure if that'll happen after 2020, so let's not take any chances. But the idea on it is anything over $11,100 that an employer pays would be subject to a 40% tax. And right now, that's not an absorbent amount compared to what they thought it was back when when Obamacare was originally passed back in 2009, 2010. So what we've got is this threat of a tax of 40% on anything over $11,100 for an individual or $29,750 for a family plan. We don't want to see that happen. We're trying to figure out ways to reduce the costs of health care, not increase the costs of health care. But that was part of the original Obamacare product or the Affordable Care Act. And it's time to finally not just defer it, but to get rid of it entirely. And that would be one more section of a repealed product that failed.
Right. Senator, it looks like it's Dagan McDowell, and that looks like something that the unions would be in favor of. No, because again, union members have, in many cases, very generous health insurance benefits, and this tax would hit those health care plans.
Yeah, they really didn't like it to begin with.
Right.
But nonetheless, now it's not just for those people that thought they had really good plans. Now, think about the logic of this. Why in the world, if an employer is offering good, high-quality health care, would you want to tax it even more and to try to slow down that progression into high-quality care products? What they looked at was and said, gee, they might be including things in there that might be considered luxurious in nature, like perhaps taking care of low deductibles and so forth. And today, I think most Americans would say, I'll take a plan with some normal deductibles or low deductibles as opposed to the $3,000 and $5,000 deductibles that we're stuck with on most plans today.
Well, I can tell you that the face injections I get are not covered by our insurance plan, so everybody can just relax.
I wouldn't know about that.
Thank you, Senator. Thank you for your kindness.
One of the things that I find fascinating about the healthcare debate, though, is so many people are focused on pharmaceutical pricing and not as much. That seems to be the candy topic. And yet the health insurance, that's being provided, every year people are feeling like it's getting more expensive. And you look at the Green New Deal, they're talking about abolishing a whole industry of insurance and really demonizing the private insurance sector when it's a really important factor. How do you navigate those conversations and try to balance out the demonization of the health insurance industry versus trying to get people health care that they feel that everybody deserves now?
Look, the idea behind private health insurance was to have competition, have different companies offering different approaches, more competitive rates or deals that they've been able to make with healthcare providers. And over the years, it actually has served us very well. The challenges come in when you compare it with what the alternatives are. If you take a look at any kind of a government-run operation, let's take a look at Indian Health Service as an example. Nobody should ever want to have their health care put together by a government-run operation such as Indian Health. Take a look at the damages that we've seen caused through the VA and the lack of attention that the VA has had. And the inefficiencies that you find there. What we'd like to see is a good, healthy, competitive market. I talk sometimes about the fact I was governor in South Dakota for 8 years. When we came in, we had a healthcare crisis. What we worked on was trying to bring in more individual and group plans. In 2009, before Obamacare came in, we had 17 companies offering group health insurance, 13 companies offering individual health care. We were competitive, but it's because because we paid attention to what we were doing, and we allowed the market to kind of work itself through and allow people to be able to move from one plan to another. We had guaranteed renewal provisions built into those plans before Obamacare was ever on the scene.
So one of the questions, just to follow up on that, a lot of people, instead of looking at the kinds of programs like the VA that you're looking at as a government comparison, look at Medicare. And they think, well, my grandparents are able to go to the doctor all the time and it's covered. Everybody should have that kind of access. And yet that's not what's going to happen under these new plans. How do you explain that to folks?
Yeah, that's right. The assumption that Medicare is not a subsidized product is wrong, because what happens is everybody else with private insurance is paying more because the government limits what they pay healthcare providers under Medicare and under Medicaid, both of which are reduced payments to physicians and hospitals. They make that up by charging everybody else a little bit more.
Yeah.
If you take away that private sector and everybody starts paying in, those discounts go away, and that becomes the norm, and the price for everybody goes up. But you also lose the competitive edge. You don't find doctors and hospital organizations competing for the business, which they do right now in the private sector today.
Right, and we know that the Medicare for All means wiping out the entire private insurance industry as well. Before you go, Senator, got to get your take on the national emergency outrage. The Senate is going to vote on the resolution. How will you vote in terms of the president's emergency declaration?
I will support the president's position. I do believe that under our existing framework, he has the authority to determine what an emergency is.
Okay.
I do not disagree with him. He has an emergency. You got 76,000 people that entered this country or tried to get into this country illegally last month alone.
Yeah, February alone. But you still have 4 of your colleagues, Republican senators, signaling they will not support this declaration, paving the way for Democrats to potentially secure enough votes to block the measure, and it will head to the president's desk, and he will veto it.
That's right. And at that point, the concern that I've got is that after that occurs, the House controls the appropriations process. He's taking funds, a couple of the funds that he has identified, he doesn't even need the emergency measures for. He can take those out of a drug fund in the Treasury Department, and he can also directly access a separate fund without ever touching the emergency funds.
Yeah.
There's only one of the funds that's impacted by his declaration of the emergency. My concern is that Democrats will probably try to limit in future appropriation bills his ability to access some of those funds, and that's where the real battle's going to be.
Well, that's a good point, actually. Senator, it's good to have you. Thank you so much.
Thank you.
Senator